These are 3 tips to make your group therapy sessions a lot more effective. And we're starting right now. Hey, I'm Dr. McCleary, and if this is your first time on my channel is dedicated to educating service members, veterans, and their families about mental health. So if that's you, consider subscribing. This is going to be a quick video because it doesn't take much to get derailed in a group. It also doesn't take much to actually be very effective in a group setting. My first tip for you: do your homework. Put in the work. When you think about therapy, we're talking about 50 minutes, an hour, maybe an hour and a half, once a week, once every other week, once a month maybe. That's not a whole lot of time. And I would argue that the real work is not just what you do in session or in group, but the real work is how you use what you learned on the outside in your real life. Homework is just a way of building those skills, because that's where you're going to be spending the majority of your time, outside of group. My next tip for you is to check your ego at the door. Often when you get a group of people together, often when you get a group of veterans together, there can be a bit of a hierarchy going on, comparing maybe your trauma to somebody else's trauma, comparing maybe your military experiences to somebody else's military experiences. Well, I was in Afghanistan. Well, I was in Afghanistan at this time. Well, I was in Iraq at this time. Well, I was in Vietnam. Well, I'll trump all you guys. I was in World War II. Maybe you let that World War II guy have that. But in general, you want to check your ego at the door, because it's not going to help you. At the end of the day, you're in group therapy mainly for you and not everybody else. So you want to make sure that you don't ruin your experiences, or possibly another veteran's experience, by turning it into, well, I'm better, or I'm less than, or I'm better than, or I'm more than. If you do that, you're not going to get as much out of the group experiences as maybe you could. Something to think about. My last tip for you: participate. Actually say something in group. Don't be the guy that just sits there in the back of the group and doesn't say anything. 1, that's awkward for everybody else. And 2, you're not fully participating and getting as much as you can out of group. Also, if you care about this, you're not helping the other people in group as well, because maybe you have something to say that's really going to resonate with or help another veteran in group, and you don't want to keep that to yourself. 3 tips, real quick, help out my fellow veterans. Go get some. If this video was helpful for you, and I hope that it was, please like it, or consider subscribing to my channel if you want to learn more about mental health, or tips on how to successfully transition from military to civilian life. But more important than that, if this video was helpful for you, well, that means it can probably be helpful to another veteran or another service member. So I ask that you share it with them, because at the end of the day, that's what all this is really about. One veteran trying to help another.